we're going to talk about cirrhosis. It is basically the end stage of a disease state. It's a late stage liver disease where the healthy liver has been replaced actually by scar tissue. The scar tissue occurs in the liver is trying to heal itself. However, it's not healing itself. The scar tissue is going to be dead tissue and non-functioning liver. It's a result of long-term hepatitis. Hepatitis in this situation is inflammation of the liver. It is progressive, it's not reversible, but there are things you can do to help prevent it and to stop it from progressing any further. What happens is you see a decreased blood flow and oxygen flow to your liver, and that decreases the ability for your liver to function, filter out toxins, and produce blood proteins as well as bile. This scar tissue also, when it occurs, can put pressure on the portal vein. Why that's important is because you can develop portal hypertension with that, which then has its own list of complications. In the United States, only 0.25% of adults have cirrhosis of the liver or end-stage liver disease, which is good. However, that number results in 26,000 deaths a year, and it's rising. So it's important to take care of yourself before it actually occurs or to prevent it from moving any further. The first signs that you can see are fatigue, feeling ill, nausea and a lack of appetite, red palms, spider veins, and upper abdominal pain. Now realize when I say that, there are a lot of things that can cause those same issues. So when you're looking at it, you have to look at the bigger picture. Have you done things in your life that would make you more prone to it? What are your liver function tests? If you go into your provider, they would be able to run those to rule out this disease. As it progresses, the advanced liver failure, you're going to see itching, rash on the skin, jaundice, which is the yellowing of the skin, yellowing of the eyes, dark urine, and light stools, so your stool color would be lighter. You will also see trouble digesting fat, so you may end up with a lot of diarrhea if you eat a fatty meal, a lot of upset stomach. Small bumps of fat can occur on your skin. Again, with that, remember we all get those little bumps underneath the skin that are just little areas where those are there, but these will be more pronounced all over the skin. Weight loss, muscle loss, changes in your cycle. If you're a female and you're ovulating, you'll see changes in your menstrual cycle. Mood changes as well as confusion can occur. If you remember, I talked to one of our lives on TikTok, we discussed the fact that the VA did a study and found that some patients with quote-unquote dementia or Alzheimer's, it was actually due to liver function, failure in the liver going on, and they were able to do something with that. You can see muscle twitches and muscle spasms also as it progresses. In men, you will see enlarged breasts too as well. Now, if you are a person that has portal hypertension, some of the things you can see with that, and remember that is related to liver failure or liver cirrhosis of the liver as it progresses. Blood in your urine, blood in your stools, blood in vomit, shortness of breath, decreased urine output, swelling in the abdomen, and then edema or swelling in your hands, feet, and legs. Now, causes of cirrhosis of the liver. The main cause is chronic alcohol use. So you want to be aware of that. You don't have to be an alcoholic to be causing cirrhosis of the liver. So you want to watch the amount of alcohol that you take in every week. Steatohepatitis is another thing that can cause that. And what that can occur from is long-term high blood pressure that is not taken care of, so it's uncontrolled, long-term high blood sugars as well, that's not controlled, as well as long-term high cholesterol that's not controlled. So again, doing something with your diet and exercise can help out with that. Hepatitis C and B can also cause cirrhosis of the liver. But remember, now hepatitis C is curable. So if you have it, talk to your provider about things that they can do to actually take care of that. In hepatitis B, most people will recover from that on their own. So that's a good thing. Less common causes are autoimmune biliary diseases, okay? Again, that's an autoimmune thing, which can be caused from infections earlier in life as well as genetics. Toxic hepatitis, which is an environmental situation when you're exposed to toxins that create the inflammation in the liver, one of which is over-the-counter consumption of Tylenol or acetaminophen. Not just in Tylenol itself, but in combination products, so things for colds, things for muscle aches and pains that may not be actually labeled as Tylenol may contain acetaminophen, so you want to watch out for that. Genetic disorders, like I mentioned, congestive heart failure can also put you at risk for this. As far as risk factors, like I said, there is some genetics in there involved, but alcohol consumption is your biggest one. Metabolic syndrome can be another one. And then chronic hepatitis infection, like with hepatitis. So you want to check with your doctor on that. Complications that you can see from this as your liver starts to fail. Your decreased immunity. You're going to be more prone to be sick from all different kinds of things, flu, COVID, colds, things like that. Hormonal imbalances. Like I said, it can affect your menstrual cycle. That can happen. Edema or swelling throughout the body. General malaise where you're just feeling ill. You don't feel good. You don't feel up to doing things. Malnutrition, which occurs from malabsorption of the proteins that you need from your diet. Cognitive impairment. And that can, not the cognitive impairment, but the cirrhosis can eventually also make you more prone to liver cancer. For treatment, again, I said it's non-reversible. If you get to a point where it is so severe they cannot do anything, of course the treatment would be liver transplant. Remember, when they're looking at patients for liver transplant, one of the things that will move you down the list is if you are a chronic alcoholic. So you've got to stop your alcohol consumption. The other thing, they look at managing the cause. What is causing your liver to go downhill? If it's something that you're doing, if it's something you're not eating or eating too much of, that's what they will do. If it's medications, like I mentioned Tylenol, there are other harmful medications to your liver as well. They'll try and remove those from your treatment. One of the other things that you can do is to manage symptoms of it. Like I said, some of the things as far as cognitive impairment, hormone imbalances, they can do some things with that. But there are many things that you can do to help prevent cirrhosis of the liver or to decrease the progression of it. Number one, like I said, stop alcohol consumption. Stop using any form of Tylenol or acetaminophen. Weight loss will help out. Exercise will help out. Weight training, even mild or low weight exercises will help you to build muscles. Eating whole foods, staying away from processed foods is huge. Whole foods and lean protein are very important. Stopping smoking and chewing tobacco is also very important. And then the last thing that you need to do is make sure you keep all your appointments with your providers. It's very important for them to monitor your liver function test as well as your basic metabolic profile to see how you're doing, to see if things are improving, staying the same, or going downhill. That's very important in your overall care. Remember to take these steps to prevent things from going further south.